Hello, I'm Mike Jones from Future Magazine, and I'm delighted to be joined by Dr. Dietmar Elsler from EU-OSHA. Dietmar, welcome.
Welcome. Thank you very much for this interview.
Fantastic. Thank you. Well, first of all, Dietmar, can you explain to me what EU-OSHA is and how it serves the needs of people involved in safety and health at work?
Yeah, we are a European agency, a European body, and we are a tripartite organization. So our board consists of workers, employers, and government representatives of all 27 EU member states. And our mission is to promote health and safety in Europe, but we have no, let's say, legal, how you call it, we cannot enforce things, we do not inspections. We work more with campaigns, with information sharing, working with our partners, like from your company, like Sovidel, and also with the member state. So we are like an information exchange platform, research platform, and we are collecting facts and figures about health and safety in Europe. We have many statistics on our website. We do a lot of campaigning. That's maybe our most visible area. The current campaign is about health and safety and digitalization. And then we are creating tools like the EURA tool, online interactive risk assessment. And we are also looking into the future, like we are anticipating change with foresight studies. For example, what is the impact of climate change on health and safety on the future workplaces?
Fantastic. Thank you, Dietmar. Why does health and safety at work need such focused attention? Why does all of this matter in the modern world?
Yeah, it's health and safety concerns the quality of life. Nearly everyone is working, and then you are exposed to risks at your workplace. And so the European Union, the countries were very successful in reducing accidents. So in recent years, we have reduced by 70% the accident rates, but we have still 175,000 people dying from work-related causes, so either from diseases or from accidents, so mainly diseases like cancer. So half of them are dying from cancer. Only 2% of the people actually dying in an accident nowadays. So we were very successful in reducing accidents, but the challenge is diseases like cancer, like cardiovascular diseases, or musculoskeletal diseases, or psychosocial diseases, which cause also a huge economic burden. We estimate that 3.3% of the European GDP, gross domestic product, is the cost equals to the accidents and diseases caused by work. So that would be over 500 billion euro every year. So that means a huge loss of productivity also for enterprises. And now we are lacking a lot of skilled workers in many EU member states. So where I come from Germany, it's a huge topic. And so we cannot waste these workers, let's say, because if you imagine we have 175,000 people dying each year and many more suffering from diseases, how many more workers we could have active in the workforce if we would be better in health and safety, because we have also the demographic change of an aging population.
Yes. The organization is obviously doing some really vital, really important work, Dietmar. What would you say are some of the landmark achievements of EU-OSHA over the years?
Yeah, I would say we are most known in the public for our campaigns. Like we kickstarted now the campaign on digitalization on 25th of October with the European Commissioner in Brussels, with the European Presidency of Spain and our director. And so, but before we did also campaigns on prevention of musculoskeletal disorders and prevention of dangerous substances, where we also try to capture the causes of diseases, which cause the most economic burden, like cancer or musculoskeletal diseases. They cause the most economic burden in the European Union, and our focus was there in the past, and now we are looking into digitalization. Then we have a huge survey, which is the ESNA survey, European Survey of Enterprise on New and Emerging Risks, where we interviewed about 45,000 workers in 33 European countries, so quite a representative enterprise survey. And we launched this online interactive risk assessment tool, which is at disposal in many European countries. And the area where I work most in, apart from the campaigns, is collecting facts and figures like statistics, which we show in the European OSH barometer, we call it, Occupational Safety and Health Barometer. So a huge, fantastic data visualization tool where you have all the data from all the member states, and really a fantastic resource if you want to compare your country with other countries. Yeah. And we're also looking into the costs now of accidents and diseases, because in many political decisions now you have to decide, do I invest more in, I don't know, prevention, or in health and safety, or in environment, or so you can spend the euro only one time. And so it's important to have a common denominator, not to compare different alternatives. And I think therefore it's also important to express the damage, or let's say the benefit of prevention in euros or dollars. And now we are working also on supporting compliance in enterprises, especially smaller enterprises, how we can motivate them to better promote health and safety, like with, for example, through supply chain measures at larger enterprises like Sopidel, influencing their supply chain, the smaller enterprise they are working with, or how we can improve the inspection in Europe with the exchange of good practices.
Excellent. Some really excellent initiatives there. Can you talk a little bit about how EU-OSHA's work contributes to the European Commission's strategic framework on health and safety at work, 2021 to 2027? Why is that such a vital program?
Yeah, it defines really the basis on what we are working, and describes the future challenges we have in society, because the upcoming changes are that we have the green challenges, the European Green Deal with a reaction on climate change. We have the digital transition of the economy, which we are addressing with our campaigns. We have a demographic transition, and so we want to improve prevention. The strategy adopted a Vision Zero approach in occupational safety and health, so striving to zero work-related deaths in accidents and diseases. And we are contributing to this, for example, with, as I said, data collection, because the basis is you have to measure what is your starting point, and then you can see where you can improve, where are the most causes of accidents or diseases, and there are the areas where you can most improve. And the third pillar, next to prevention and anticipating change, is also increasing preparedness to future health crises. Like this is a consequence of the COVID-19 pandemic, now that we have to be better prepared for next crisis, and how we can influence the workplaces to be better prepared for this.
Fantastic. Dietmar, you mentioned there about the one of the focuses being the digital transition.
Yeah.
Why are partnerships such as your organization's campaign with Sopidel on, for example, the 2023 to 2025 safe and healthy work in the digital age important? And what kind of What kind of difference can these partnerships make for businesses that really diligently focus on this area?
Yeah, I mean, we are a rather small agency of 65 workers in Bilbao, in Spain, and therefore we really need partnerships. That was from the beginning our approach. So we have established focal point network in all the member states. In Italy, that's ENILE organization, for example, and but we are also working directly with campaign partners like multinational companies like Sofidel or like professional organizations, social partners. We are working with them because then we have the direct contact with the workplace, and it's of mutual benefit, we think, because we provide campaign material in all the European languages. So if you are a multinational company, you can roll out the campaign in your different plants in different countries in the different languages. We offer you opportunities to exchange good practices, to take part in our events, and to promote the campaign on our website. But then also Sofidel, for example, as a campaigner, is promoted via our website, our social media channels. So this is a, let's say, of added value of mutual benefit for both, for the partners and for EU-OSHA. And for us, it's really having the stronger link to the workplace, now to have a kind of reality check now when we discuss with paid partners. So that's what I really like, to be in contact with companies like Sofitel, for example. They invited us once to visit their production, and it was a very exciting meeting for everyone at Sofitel.
Thank you, Dietmar. And how do companies like Solfidel set a good example, would you say, by taking the issue of healthy and safe workplaces seriously? Why does that help?
Yeah, I would say Sofitel is really acting as a multiplier, as a model in their region or in their supply chain. Now, if Sofitel sets a good example, they will also influence their supply chain. They will also deal responsively with their supply chain in health and safety. And we know Sofitel is a strong supporter of the campaign since the beginning. So they are a long-standing campaign partner. They promote our material via the website, via social media, and also Sofitel, they are always willing to share their experiences. Now we had a steering group member, Michel Morganti, who was really presenting several times the good practices you have in Sofitel, for example, in MSD prevention, and during our campaign for healthy aging. I think it was in 2017. We even organized in Lucca, near your production site, a meeting with all the campaign partners, where we invited them to come along to visit the production of Sofitel, where they showed us around how they are practicing really health and safety management, and also to exchange good practices with the other campaign partners like Toyota, like Siemens, like SAP, so other companies who joined the meeting, and it was really first-hand information, very helpful for everyone, and a very, very great hospitality, of course. We met with Sofitel. It was really a fantastic event, and we really are very grateful at EU-OSHA that we have this support by Sofitel.
Excellent. Well, thank you, Dietmar. And let's talk a little bit about what the future looks like for EU-OSHA. What other programs will you and your team be working on in 2024 and beyond?
Yeah, so we have the upcoming campaign that just started and will run until 25. So we have many events now during this campaign on digitalization, where also companies can participate as campaign partner, or they can hand in good practice examples for the European Good Practice Award competition. Then we are already working on an upcoming campaign after this on psychosocial risk factors. which is also an emerging issue in many countries. Just next month, we have a publication of our worker exposure survey on cancer risk factors, where in a few countries we had an innovative survey asking workers actually if they are exposed to risk factors, because normally you don't have any data on risk factors. It's really difficult to measure this. And but for example, if you know the kind of work where you're working, you can estimate like what is your exposure to sun radiation or diesel exhaust or other cancer factors. And this is really an innovative survey to find out more about the origins of cancer and then help to prevent cancer. As we know, half of the workers in Europe who are dying from work-related causes are dying from work-related cancer. And then, of course, as we have the European Green Deal, and we all know about the impact of climate change, so the sustainability discussion is a huge issue. It's high on the European agenda. We have a new corporate social responsibility directive, which is affecting companies like Solidel and also from other companies. They're really working hard to implement this. And there's even this new directive on due diligence, so also concerning the supply chains, with, where we also take more responsibility for supply chains in other countries. And there are we working as well on the foresight, now that we are seeing in the future what is coming up. We just finished a foresight on the circular economy. So if we implement more circular economy, recycling waste and so on, using different materials, what influences will have on health and safety of workers. And we are working on a new activity on climate change. So what is, for example, the influence of heat stress, for example. There are studies that show that clearly heat is not only dangerous for workers who are directly exposed to it, like in construction or agriculture, we have sun radiation and so on, but also if you work in an office, but if it's too hot and you get deep sleep deprivation, and then you are much more likely to have an accident the other day. So these are, we can show also with statistics, so there's a big effect on climate change. And yeah, maybe if we're looking at the future, the current, let's say, efforts are more directed to health promotion or prevention of diseases, but we want also to come back again to a more classical topic like accident prevention in the next 3 years, because we see we were very successful in reducing accident numbers, but now we have a kind of plateau effect in many countries, so the curve is not going down anymore. It's like stabilizing on a relatively low level, but we have still 3,500 people dying each year. We have a lot of traffic accidents which are connected to this. So, and if we want to bring this to zero, we also need more efforts and more research. And that's another topic where we are looking into the future now. But this is upcoming work.
Brilliant. I mean, these are all excellent initiatives. Dr. Dietmar Elsler, thank you so much for taking the time to tell us about those, and best of luck with the campaigns in the future. Thank you for your time.
Thank you very much, Michael. It was an excellent interview. Thank you.
Thank you.